agency to always serve all sectors of the population, but we were sure glad we were able to pick up that ball while the other agencies were closed down.
Awesome, thank you. So now we're going to discuss how COVID-19 affected your PS 15-1502 and PS 17-1704 programs specifically. How have your 1502 and 1704 programs been impacted by COVID-19?
Yeah, Jonathan and Jamil, I'll let you jump in. I know the overall takeaway lesson is we still met all targets every month, but they can explain it.
This is Jonathan. I apologize for before. We lost internet. Hopefully it doesn't happen again. So we got our internet back. As far as how it affected us, I don't know if affected is the correct word to say. I think it just made us try to strategize differently on how we would reach our clients. So I guess obviously we stopped having our empowerment group in office, but didn't mean that we stopped conducting our empowerment group. We went virtually, so we started using Zoom, and it's been great. I think that the guys enjoy the distraction of just being at home. So being able to jump online and having a core group and having an M group and having some type of socializing in their lives has definitely been good for them.
And the empowerment is done under 17-1704?
Correct. Empowerment is 17-1704.
Any comments on how your 1502 program was impacted by COVID-19?
The only other impact that I'll add, and I'll let the other guys add more, is we had two staff, one in each of our Miami offices, move on and leave the agency because their families were uncomfortable with them working in a community setting. So one of them was told that if he continued coming to work, the family wouldn't let him come home. And the other one was more just a matter of discussions leading to anxiety. So we did have the additional burden of having to replace staff in the middle of the epidemic.
And this is Jamil. I would like to say that on the clear portion of 1502, obviously the face-to-face contact had to be either far apart or even sometimes it would have to be virtual. So, but we continued meeting our requirements for clear.
So I know we've talked a little bit about how your programs for 1502 and 1704 were impacted by COVID. Now I want to specifically talk about how your 1502 and 1704 testing programs were impacted by COVID. I know you mentioned that you didn't shut down. You continue to provide your services. You continue to take walk-ins. But could you just elaborate a little more on how 1502 and 1704 testing programs were impacted by COVID or not?
Orlando, I'd like you to take that on both the counts of HIV and STD and what you're aware of with just the general trend on lab costs.
Orlando is not on the call, but he's right here, so I will relay the question. Okay. Orlando, how would you say that the COVID epidemic affected our 1502 and 1704 testing?
I'm Orlando Sosa. I'm the testing program coordinator for Latino Salud. During the pandemic, we experienced high traffic of clients coming from other places that were closed. We get a little reactive, new infection. We're the only open doing testing. We'll be able to help more than 20 clients with the linkage to care process to getting care. Some of them were out of care, and some of them were new infections. It was a little stressful because, as Jamil said before, was how the staff. Some days we had more than 36 clients per day.
And to piggyback on what Orlando said, we had a very high numbers of not only HIV reactives, but also for STIs and Hep C. So we were definitely meeting a demand that would have been unmet if we hadn't been open.
Interesting. I have a question. Did any of the clients ever give an explanation for coming in for services at this time?
Well, many of them were saying that they wanted the services either way,
Okay.
and that there was just no place else they could go. We did find, maybe I'm old school, I sort of expected there'd be less need for testing because people wouldn't be hooking up anymore. But of course, that's not human nature. And that's, Orlando, if you're still nearby, you can probably call this number off. For the agency, not just the CDC programs, although those represent the lion's share of our work. But for the agency, Orlando, since mid-March when the epidemic began and the other agencies closed down, about how many new HIV diagnoses have we had?
Yes, Dr. Follow. For the month of March, we had like 14 new infections, new diagnoses.
And for the total from March through, let's say, August or so, what were we up to?
Around 40.
Around 40 for those, what was that, 5 months?
March to August, yes.
Thank you. I know you spoke briefly about linkage to care and that you were able to link over 20 clients or link or re-engage them into HIV medical care. Is there anything that you would like to add regarding your 1502 and 1704 programs and how linkage to care was impacted?
Jonathan or Roman, would you like to take that?
I'll go ahead and I'll jump in. When the pandemic started, a lot of clients' appointments that were already made were canceled or postponed by, let's say, the health department or other nonprofit organizations. So we made it a point to keep great contact with our clients to make sure that we followed through with their upcoming rescheduling of appointment. And I would have to say I'm happy with the services that my staff were able to conduct because we were able to get clients to their second appointment.
How would you say your 1502 and 1704 PrEP referral services were impacted by COVID-19?
That also goes in hands with what I had mentioned before. A lot of appointments that were made, were just not even postponed, but they were canceled. So we found we had to reach out to other organizations or other places to have appointments made. The health department was one location that was canceling appointments without rescheduling them. So it was just a matter of keeping contact with clients.
Jamil, you sent an email on that just this morning. So the health department down here, they have AIDS Healthcare Foundation run their wellness clinic on a subcontract. And they did continue services in just one way. If you had already been enrolled and initiated on PrEP, they would refill the prescriptions, but they were sending patients out to for-profit labs off-site and then having them just get those results transmitted in to renew their PrEP. So at first it was a very negative impact of all these locations and facilities being closed. separate from our 1502 and 1704